Hi guys, welcome back to my channel. My name is Rumbi. If you follow me on other platforms, you would know that I've been trying to make that transition, that pivot into health tech, digital health, femtech, in addition to my work as a doctor. And so I got the chance to go to Giant Health. It's a digital innovation conference, which is done in London in partnership with the NHS. I think they work in partnership with the NHS. It's very NHS heavy. Um, and there were lots of tech and startup founders as well as just innovative companies that were there. I got to host interviews for their live podcast. So I thought actually I would love to share some of those interviews here and some of those conversations for my community. I might just start a little something, something, where we do something similar, have conversations with people that are doing interesting things. Let me know if that is something you want to see. Otherwise, enjoy the interviews. Hi, Giant is still going and I'm having a great time. We're joined by another guest. I'll let you introduce yourself and tell us a little bit about what you do.
Okay. Hi. My name is Ufoma Okweahoff. I'm a digital health project manager. So my day-to-day job, I work in the ICT infrastructure. So I just make sure that we implement and improve our ICT infrastructure and make sure that we're up to date in our security systems.
What are you finding are the challenges, especially with security at the moment? Cybersecurity is a big talking point.
Yes. First thing I would say is bureaucracy because the NHS still doesn't take. Oh, can I say that? We still don't take security as importantly as I believe we should, and also the paperwork that goes into procurement of getting in the best security software. And if I should mention something to the assessment of security software that trusts have at the point in time, documenting that, inventorying that, making sure they're up to contract, it's a long process. So yes, that's the key.
That is amazing. Thank you so much. And any parting words for me as an NHS worker to make sure I'm keeping my department safe?
Please, your password shouldn't be 1234, and make sure whenever you take your laptops to the coffee shop or anywhere, you're using it safely. You're making sure the Wi-Fi you're connecting to is done properly, and don't click any link you don't trust.
Don't click any links. I think that's a great parting message.
Yeah.
I am joined by the amazing founder of We Are Eden. I'll let you introduce yourself.
Hey everybody, my name is Fari Raigora. I'm the founder of the world's largest and most effective reproductive healthcare insurtech, where we've taken on the $20 billion opportunity in the UK for improving talent attraction and retention through better reproductive healthcare outcomes. And over 750,000 people are waiting on the NHS for reproductive healthcare. We know that 15 million totally in the UK are affected out of the 37.5 million workforce. So we're really excited to make this problem go away and improve the experience for employers and employees all around.
And it sounds like a huge problem, like you've said. What's the work that you guys are doing so far to try and address this problem?
In terms of the work that we've done at We Are Eden, we are currently focused on the democratization of the education aspect, because we find that with a lot of the reproductive healthcare treatments and conditions, people over 60% can't afford private, and then we also see that in the private healthcare space there is a lot of hard selling of tests and other treatments people don't really need. So we focus on the education aspects, engaging a lot of healthcare professionals, of which Rumbi is one, in our proof of concept Eden Talks, which is a proof of concept webinar and it's publicly available on LinkedIn. Just go on my page and you'll see it. It's featured right at the top, where experts like Rumbi, like Dr. Rumbi, like Dr. Remy, and Dr. Gio have come on and spoken about what they're seeing clinically in reproductive healthcare, why the system is broken and how we can fix it, and how to improve patient outcomes.
That is fantastic. Thank you so much. Thank you for joining me. We are back with our next guest. I'll let him introduce himself and tell us a little bit about what company you're with.
Sure. Well, thank you for having me. I'm Almari. I'm the CEO of Circular. Circular is a smart ring brand, health smart ring brand. And we're here because we're introducing a new model of our smart ring. So a lot to uncover and discuss. Yeah.
That's amazing. amazing. I feel like we're in a smart ring revolution at the moment. What differentiates Circular from some of the other competitors in the market?
You're right. So we started in 2019. Back then, we were the second smart ring in the world for health tracking. There are more and more smart rings coming out, especially from big groups also now. So it's now becoming more and more a race to innovation, especially in 2024. We've seen at least 10 brands come into the market. I think that you can play on very niche markets. We're going more and more towards health, whereas other rings are still focused a lot on wellness, which is great, but more B2C focused.
Yeah. And that's fantastic. Now, I know you guys are based in France.
Yeah.
What have the challenges been trying to diversify or scale outside of France to the rest of the EU or the world in general?
Yeah, so we're based in Paris, in France. We've always made the products as well in France, which was another challenge by itself for a lot of reasons, which slows down also a lot. But apart from that, on the selling perspective, we've always started selling internationally from the get-go. We did a Kickstarter in 2020, and we did most of our sales in the US, in the UK, in Germany. And so we've got this little reputation internationally already. So we're fortunate enough for that.
Do you have a market where you would say that's your biggest market at the moment?
Geographically wise?
Yeah.
Probably the US, although it's slowing down a little bit, and we're seeing more and more Europeans buying the ring. Yeah.
And I know before we started speaking, you showed me you actually have the new smart ring.
Yeah.
Is it too soon? We can't preview it to the people.
Yeah, we're gonna make a big announcement at the beginning of the year. I can show a bit about it, but I'm using the older version and the newest version.
Yep.
It's a huge difference between both models.
Yep.
As I was saying, we're focusing more with the new model on health metrics, and we're going to be able to detect medically with medical accuracy certain conditions, which we weren't able to do with the previous generation.
Wow, that's amazing. I guess just to round off, what's coming up for you guys in 2025?
I think this model will be our big thing in 2025. As we're doing that, we're switching more and more also to B2B, which is a huge opportunity for us, and developing tools for businesses to be able to track people's health more accurately.
That's fantastic. Well, thank you so much.
Thank you.
We have another guest with us. I'll let you introduce yourself and tell us a little bit about what you do.
Hello everyone, my name is Ravinder Punya. I'm the founder of Bloom Health. Bloom Health is opening its first private hospital in central Milton Keynes. It will have an out-of-hours urgent care center with state-of-the-art blood lab, X-ray, ultrasound, and an MRI. We will have our focus in pediatric health. We'll be doing pediatric endocrine, pediatric diabetes, pediatric epilepsy, and obesity. We'll also have focus in general adult health as well.
That's really interesting. I was saying, so my background is as a doctor, and I read the other day that there were 230,000 private hospital admissions in the second quarter of 2024. So that's a really booming industry. What have you found, especially getting set up?
Well, for me, the reason behind the setup was my own experience. I've got 3 kids, and every 3-4 months I'm in A&E or urgent care center, and the wait is too long. So we decided that we're going to open a facility where people can come in and they don't have to wait for 8 hours.
And in terms of getting up and running, when will the facility be up and running?
We envisage the facility will be up and ready in May.
In May. That's amazing. And are you taking fee paying or insurance or a combination of both?
So the pathway is we have self-pay. We're also going to work very closely with our ICB, local ICB, as well as Milton Keynes University Hospital.
That is amazing. Well, thank you so much for joining us. Thank you.
You're welcome.